Good morning, friends. Today we are back with share with my experiences on the repertory that emerged thoughts. It is there now. Talking about the symptoms, connecting some symptoms and collecting symptoms observed in patient with rubrics is like putting our own observation to fit in a wider range of understanding. Case-taking process has to be realistic in nature and should not be encumbered with thoughts prevailing in the mind. With predefined questions, we have the limited scope to assess the prevailing state of the patient's mind and body. Usually, one try to find out the rubrics directly during the case taking. This attempt becomes a shortcut process for evaluation. We need to get the symptoms first from the patient as they are observed or heard, and then look into the repertorial language. It should be translation work of the patient's language into the repertorial language. Of rubrics available, there are hierarchical order which range from wider general to narrower specific. When we look for some rubrics, we must go into the details of the whole range of the particular rubric to get the exactness. We should not try to avoid interpretations of meaning of our own. We must keep in mind that meaning expressed in rubrics are only as understood by the author. They may vary from the universal meaning at many places. Overgeneralizations of meaning usually makes distortion in meaning. Where there are confusion about meaning, we should go through the medicine's symptoms as presented in the materia medica. Many a time, similar rubrics come into the mind during those situations which are available in repertory as cross-reference, we should need to compare the meaning of both the rubrics together to get the exact meaning. Synonyms are also available that often helps us to get the exact. Usually, mind rubrics are confused with the psychological terms, but repertorial rubrics are and mathematical symptoms are as observed in the patients or during the proving. We have to be careful while we apply meaning. Now, for different rubrics, but they are following format of the old repertory. Even repertory rubrics remains the same. The new medicines are added. All these aspects needs analytical skills to get the best. So this is understanding that how to convert the medicine symptoms, observed symptoms of the patient into the symptoms of the repertory, that is rubrics. So with these words, I thank you very much for listening. We shall meet again for with another meetings. Thank you. Thank you very much.